Welcome everybody to this panel on harnessing the power of digital technology for global health, and for finding your way here ahead of the opening ceremony at 6 o'clock. We're delighted to see you all. We have a fantastic panel assembled, 4 on stage, Mr. Setiaji joining us on the screen, and I'm absolutely sure you will all leave this room enriched and excited about the opportunities we have to transform global health over the coming years. So let me start with some introductions. I'm Susan Thomas, and I'm a director at Google Health, and I have the pleasure of moderating this esteemed panel today. Speaking on the panel, we have Marlies Gerkens, lead of the Digital Health Flagship Programme at the World Bank. This is the bank's global programme on innovations in health and human development, and has the aim of solving pernicious human development challenges exacerbated by the COVID-19 pandemic in low and middle income countries. She has an extensive academic and non-fiction publication record and is on the editorial board of 2 journals. Online joining us at a really late hour for a Sunday, for which we are hugely grateful, we have Mr. Setiaji, Chief of the Digital Transformation at the Indonesian Ministry of Health. He also acts as chairperson for HIMSS in Asia Pacific. Over the past year, he has led the release of the Digital Health Transformation Blueprint 2024 for Indonesia, which I'm sure he will be telling us about in more detail shortly. Next, we have Dr. Ivor Horn, who is Chief Health Equity Officer at Google. Ivor leads a cross-functional team that provides health equity leadership to ensure that health-related products at Google, our research and other initiatives are diverse, fair, accessible and inclusive. A nationally recognised leader in health equity, social determinants of health and healthcare innovation, Dr. Horn has served on a number of advisory panels, including the National Institutes of Health and the Robert Wood Johnson Foundation. And she has co-authored, along with Dr. Karen DeSalvo, Google's Chief Health Officer, one of the essays which has been published to coincide with this summit in Health, A Political Choice. Ivor's essay is on the transformative potential of AI to improve global health equity. And you can pick the book up later in the lobby, or indeed there'll be QR codes where you can find it online. From Bajo, we are delighted to welcome Dr. Garcia Seso. Sebastian is a medical doctor and public health specialist, currently serving as the director for the Department of Evidence and Intelligence for Action in Health at the Pan American Health Organization and World Health Organization. He has lectured at various academic institutions and has contributed significantly to international publications focusing on digital health health system organization, information systems, digital health, and addressing global health challenges. Finally, last but by no means least, it's a pleasure to welcome Dr. Alain Lebrique from the WHO. He is the Director for the Department of Digital Health and Innovation at the WHO, and has led the development of the Digital Health Strategy, which again I'm sure we will be hearing about shortly. He is also the founding director of the Johns Hopkins University Global mHealth Initiative, a multidisciplinary centre of excellence of over 150 projects engaged in mobile health innovation and research across the Johns Hopkins system. Thank you for joining us. When you think about digital global health, there's a need to prioritise health interventions that will get rolled out, and standardisation is going to be key for decreasing fragmentation around the world. Digitisation infuses every aspect of our life, and ensuring health is a part of that is ever more important, and often we've seen it be left behind. Over the next 90 minutes, we'll hear both the global policy framework perspective from Marlies and Alan, as well as how things are playing out at a national and regional level, which I'm sure is going to lead to a fascinating discussion. So let me just tell you about how the next 90 minutes will run. I'm going to invite each of the panelists to talk for around 5 minutes on their thoughts and approach to this topic, and they'll each stand at the podium with a set of slides. We'll start at the global level with the World Bank before delving into what's happening at a country level with Mr. Setiaji. Just to let everybody know, because of the way the IT system works, we won't be able to see Mr. Setiaji when he's speaking and the slides are being presented. We will be able to hear him. Then at the end of the session, we'll drop the slides down so he can be a key part of the discussion going forwards. After we hear from him, Ivor will focus on how information is a determinant of health and is therefore critical in driving digital global health, before looking back up to the regional lens with Sebastian and then the global position with Alan. After this opening round of viewpoints, we'll then move to a discussion between the panelists before summing up in plenty of time to get you off to the opening ceremony at 6. So without further ado, Marlies, would you like to give us your perspective from the World Bank? Thank you.
Slides, please. Thank you. Hi, good afternoon, everyone. It's wonderful to be with you today. Next slide. Thanks, Vaughan. In 2016, the World Bank launched our annual World Development Report with the title Digital Dividends. And what the report was all about was saying that we have broken through the cusp of a new era in digitalization, but the digitalization is unevenly distributed and that needed to be changed to bring value for everyone. Following up on that, in 2021, the World Development Report spoke about data for better lives, which was all about how we harness the power of data to bring value in an equitable way to everyone. And last year, in 2022, the World Bank agreed with its board on an approach to digitalization and development that encompasses 5 critical areas: digital infrastructure, digital platforms, digital enablers, digital safeguards, and of course the essential cross-cutting areas of social and gender inclusion, as well as regional and global cooperation. Looking within the health sector itself, next slide, thanks Vaughan. Looking within the health sector itself, the World Bank has recently launched a new flagship report called Digital in Health, Unlocking the Value for Everyone. And in that report, we look at what are the investments that the World Bank has made in the last decade in digital health. As you can see on the slide, in the last 10 years, the World Bank has invested around $4 billion, of which around 60% has been in sub-Saharan Africa and in South Asia, and the rest equally distributed in other regions. You can also see that these investments spanned a wide variety of different areas, ranging from foundational investments, such as investments in digital ID and connectivity, to a strong focus on health information systems. Indeed, we have funded the strengthening of health information systems in over 70 countries. What you can see has not been as strong a focus is our investments in the frontier or the innovation end of the spectrum. And that's one of the things that we believe needs to change in future, especially with generative AI on our doorstep. Of the total amount of $4 billion that we've invested, it accounts for about 6% of our portfolio in health, nutrition, and population. But equally important, and I have to say this was a surprise to us, is that investments from other sectors, such as digital development, our governance, global practice, as well as social protection and jobs, were equally strong investments, really underscoring the need for an all of government, all of society, and cross-sectoral approach, even when we discuss the use of digital technologies in health. You can see that 84%, by far the majority of our investments, have been in either foundational infrastructure or in information systems. And if we look at just the dark blue, which would be on your left-hand side, you can see that 52% of our investments from the health, nutrition, and population global practice has been in information systems. This is a good foundation, and a lot has been achieved, but we need to do more. And so in our flagship report that sets the stage for how the World Bank sees investments in digital technology and data moving forward, we said that to usher in the next era of extracting all the value, unlocking all the value for everyone, we need to move from an approach of essentially digitizing health data and digitizing the current ways in which we're delivering services to a digital in-health approach. I would be so bold as to say that if we're really successful in this mission, digital health as a concept will not be with us in a decade from now, because digital technology and data will be an embedded and seamless part in how healthcare is delivered. Think about banking, or think about making a phone call. We don't talk about making e-phone calls or doing e-banking. We just bank and we call. In a similar way, we will receive healthcare, improve our own health without the E in front of it. So we need to think differently in digital and health financing, digital and nutrition, digital and pharmaceutical development, digital and medical education, digital and service delivery. It cuts across everything. Now, with this as the vision of how the bank sees investments in digital technology and data moving forward, on the next slide we can see what is it that countries need to do different. And our advice and the things that we will be investing in the future is to help countries to do three things well: prioritize, connect, and scale. Prioritize to solve health problems, prioritize to improve equity, connect all the misaligned and disjointed health information gaps and silos that already exist, and scale with good governance, an all-of-government approach, literacy and trust built into the system from the get-go, and the nimble and agile involvement of the private sector through private-public partnerships, but also innovative private-private partnerships to ensure that we build both global and homegrown private sector expertise. And if we do this well, we believe that we will unlock value for individuals to make health more personal and reduce health differences. We believe that it can be done to save money and to improve health financing and stop this rapid increases in health expenditure and health costs that we see, particularly in a post-COVID era when fiscal space for health in many countries, particularly the most low-income and fragile state countries, is very constrained. We believe what's not often discussed in digital health is the value that it will bring for providers. Providers struggle. We have a shortage in healthcare workers. We know that burnout rates are high. We know that attrition rates are higher than they've ever been. And we believe that technology can improve conditions for health workers, make it an exciting place to come and work. And we believe that digital, if we do this right, can help to accelerate earlier and better public health actions. And finally, on the next slide. Oh, sorry, that evidently was my last slide. I actually thought I had one more. The power of technology, digital in my messed up presentation, my closing. But just to say that this is what we believe a digital in-health approach could do, and that if we're successful in the future, digital health is not going to be, because it will just be the technology and the data that helps us to do what we're all here to do, which is to make health better for as many people as possible. Thank you very much.
Thank you, Marlies. And now we'll ask Mr. Setiaji, if you could tell us about the digital strategy for Indonesia that you've been leading. That would be super. Thank you.
Yeah, thank you. This have my slide. Yeah, good afternoon. Thanks for having me today, and apologize cannot join offline. In the 5 minutes forward, I will share our journey and what we have already done, and the next target to digitize the healthcare ecosystem to enhance patient services in Indonesia. Yeah, we learn a lot from the pandemic. Actually, it's make me also our country wake up for the situations. It's very important to digitize the healthcare. So through our experience in facing the pandemic and crisis situations, we understand that integrated data and synergistic technology are a key to building healthcare resilience. To establish a resilient society against pandemics and a future challenge in Indonesia, it's implementing a comprehensive transformation to strengthen its global health foundation. In response to the COVID-19 pandemic, the acceleration of digital transformation has become one of the top priority agendas. The Ministry of Health of Indonesia released the blueprint for the Digital Health Transformation Strategy 2024 in the end of 2021. Is available for download on our website, dto.kemkes.go.id. This strategy outlines how Indonesia can use digital information technology to achieve its goal of providing universal accessibility, equitable, and high-quality healthcare services for all Indonesian citizens. We have a three agenda. First, how we need to integrate in the data from all the health facility. Actually, we have 60,000 healthcare facility. And then the next target is how we make efficient our healthcare applications and system. And then the important thing is how we build or make growth our ecosystem. Next slide, please. Yeah, this is our milestone and target into the 2024. In the first target, we need to make the data integration and build the standardization. After we launched the blueprints last year in the mid of 2022, so we launched the Health Information Exchange, or we call this platform Satu Sehat, or in English is One Health. This platform, we put in the standard and also some terminologies standard from the international healthcare. And with this initiative, so we want to build what we call the national medical record in our countries. And then this platform can streamline and access and management of health information by connecting all healthcare data sources from the 60,000 healthcare facility, including laboratories, pharmacies, insurance company, and many more. This is both private and also the government. Satu Sehat platform fosters consistency, security, and interoperability within healthcare services. And then the next target is how we can make efficient healthcare application and system. The Ministry of Health very struggle because we have more than 400 applications. Every healthcare facility needs to put many applications. For example, in the primary care, we have 70 applications. So you can imagine how burden for the health workers to put many applications. Because of that, we need to simplify and focus for the services rather than reporting. Yeah, this application categorized for the general public, healthcare professional, and healthcare facility, are configuring into the Satu Sehat database, and also put in the Satu Sehat mobile. Last year, we have the COVID apps. Actually, COVID app already downloaded more than 100 million people in Indonesia. And then we transition this year COVID app into Satu Sehat mobile. So in the last features of the Satu Sehat, we already upgraded the Satu Sehat mobile, and then our citizen now can access all the medical record from the health facility already integrated with the Satu Sehat. And then the next important thing is how we can build what we call the ecosystem, because it's very important thing we outreach or encourage all the startup, all the health tech, and then we promote the new innovation, for example, like telemedicine, and then also we build the VGSI. Actually, this is the genomic, so we also in the futures to build what we call the precise medicine. Next slide. And then this is back here. Sorry, back slide. Yeah, after the launch and then also integrate the activity, integrating the healthcare facility. So this is the sum of achievement into 2023. This is the actually still not the end of May. So we still look for some of our achievement, not only can integrate all the health facility, more than 10,000, and then we already launched the new features, what we already mentioned about integrated and also access the medical record for the personnel. And then the next, also we provide the dashboard into the national level. Not this data are coming from the health facility directly. This is the real time. So every regional can access their data, and also we in the national can access the same data into this platform. And then how we can do fastest, because we focus how we can collaborate within all the stakeholders in Indonesia, not only from the academician, from the startup, from the internet providers, from the private sectors, and also from the government in Indonesia. As you know, we have more than 34 provinces in Indonesia. Now we collaborate within the regionals to make sure all the data can streaming from the health facility, and then we can access the data from personal and also from the national level. Thank you. Yeah, back to Molly.
Thank you so much for that really clear outline of what you've been doing and what is to come in Indonesia. Iva, can I invite you to talk about the importance of information as a determinant of health and the health equity aspects of this digitization of global health? Thank you.
So I want to take a moment. Thank you so much for this opportunity to share. At Google, one of the things that we recognize is that 3 out of 4 people really come to the internet when they are looking for health information, and we want to make sure that everyone has access to useful health resources, and that is authoritative and accurate. You can identify the 2 sources, the 2 essays that we have, one by myself and Dr. Karen DeSalvo on AI's transformative potential to improve global health equity, as well as my colleague Garth Graham from YouTube Health on a more equitable future for health information. Next slide. When we are thinking about this work at Google, we really think about it in terms of what we call the 3 C's. We think about our consumers, caregivers, and community. And oftentimes what that means is making sure that as we're sharing information, as consumers come to us looking for information, that when they are searching for that medical information, they come to search and they come to YouTube first. Often depending on where they are. So one of the opportunities that we have is to make sure that that information is authoritative and accurate. One of the benefits of that has been in a partnership that we've done with the WHO in collaboration with the WHO this year to identify what does it mean to have authoritative content and what does it mean for that in terms of digital health. I apologize, I'm gonna go to this. So for us at Google, we recognize that information is a determinant of health, and it really informs decision-making for people on their healthcare journey. And as a global community, it is really our shared responsibility to make sure that we are providing better, more equitable, and more sustainable information. Our data commons team has worked with the UN statistics team to actually begin to track progress on things like the UN SDGs, and that's part of the work that we think is important to do. One of the things that we do as part of our work is, as you see here, our search knowledge panels. And Google has been helping people find that trusted and relevant information through those knowledge panels. And we learned during COVID the opportunity for that is in understanding not just things related to infectious diseases, but also health conditions in what we call our 3 M's in the areas that we want to focus on. That is metabolic health, malignancy, maternal health, and mental health. And one of the areas that we, in doing our work in mental health, it's not only just providing that language, that opportunity in English, but one of the things that we've done is to really work to decrease the stigma of something like mental health, and then to expand the language access. And one of the areas that we had an opportunity to do early on this year is to expand the access to our mental health information into Spanish, the 2nd largest native speaking language in the country. And that has, and to reduce that stigma has been an important opportunity, and we will continue to expand opportunities for language diversity in languages such as Arabic and Chinese and other areas as well as part of this work. Next slide. And the next thing that we recognize as part of this process is we really want to make public health public. And so oftentimes that means reducing the stigma of supportive information around mental health and physical health, but it's also launching it in a way that people can connect with a trusted source that they identify. And oftentimes, one of the things that we think through is when we're talking about health, the first person that comes in a home to bring health into a home is the mother or the maternal leader of the home, in making sure that they have a resource and support for identifying information in ways that they can understand with trusted sources that they can identify. And those personal stories and that connection with personal people that are a trusted source, because we know the messenger matters. And as part of that, one of the things that we want to do is make sure that in addition to that those creators are also providing accurate information and consistent evidence-based information. So that's another part of the work that my colleagues at YouTube have been participating in. Next slide. And lastly, when we think about caregivers, oftentimes when we're thinking about access to information, we're looking at access to emergency maternal health. And we did a collaboration in Nigeria, not only to identify where is maternal care and what's the accurate maternal care, but also how can we identify the ease with which you can get access to emergency maternal care, where are those locations, and understanding the distance that it requires to travel so that people can provide better care and understanding. So, and to that point, we understand that not only is it the work that we do and the information that we provide, but the key is partnerships and collaborations. We cannot do this alone, and partnerships are key as part of that process. Next slide. And lastly, I'll talk about our general artificial intelligence. We know that over the last year, we've seen this increase in information and understanding of artificial intelligence, but we know that this has the potential for significant planetary scale impact on health. And we want to make sure, one, that our AI products are being developed and synthesized for complex medical information, to share and increase information and increase knowledge. It's not something that's going to be done away from providers, but this is something that is done with healthcare systems and with the provider community. Also, the opportunity for research organizations who are really interested in leveraging AI technology to develop drug development. We know that we've had an opportunity to share our information and with our AlphaFold effort to significantly increase the speed with which that research was able to occur. Typically, that would take multiple PhDs several years in their own study to do that work, and they came together using AI and generative technology to actually shorten that time to move us faster to the place where we could begin to do that research and sharing that research, which has been shared with scientists across the globe thousands of times to increase that work around the protein in as part of that process of AlphaFold. And then the AI-powered predictive models and analytics that can detect health trends and outcomes. And this is work that we've shared, and as I mentioned to you, the work that we've been doing with Data Commons and in our collaboration with the UN on the SDGs. And lastly, AI software to really begin to create an opportunity to provide education and improve patient care. One of the things that I think is important, we've mentioned MedPalm and we've talked about MedPalm, and MedPalm is a large language model that our team has worked on to improve so that it can help to inform and provide better information for physicians and healthcare providers as part of their medical decision making. One of the things that was important about that is we brought together a very multidisciplinary team that included both physicians and lay workers to assess that, to make sure that it was diverse and that it was representative and answered questions across thinking about bias and fairness and equity as part of that work. Next slide. And you can, as I mentioned, you can learn more about the work that we're doing, and I'm looking forward to having these conversations and sharing a little bit more during our panel discussion. Thank you.
Thank you so much, Iva. It's taken us almost half an hour to get into mentioning generative AI, which feels like it might be a record at a conference at the moment. But I really liked, in listening to you there, was the AI work is really important, and I think all of us would recognize that, as we think about global digital health. But actually, there's a lot of space for the more simple stuff, getting the data right, which is what Mr. Setyaji was speaking about and you were speaking about, and then also how do consumers access information? You know, on those platforms, the internet, 2 out of 3 people come to the internet for that information about their health. So whilst AI is really important, we need to see it as a tool amongst a panoply of tools that we're going to help transform this world with. Sebastian, can I invite you to speak from a regional perspective on this?
Thank you, Susan. And I too would like to start by thanking the organizers for considering having this regional perspective and how to bring that into the equation of what's been happening over the last years on this digital transformation journey that every single country in the world is having, and how this translates to different regions and different priorities, because there's no one country identical to the other. So what's been a priority in one country might be the solution in another later down in the time frame. So this is the perspective from the Americas, and if I can have the next one, I'm going to focus on what's been proposed from the work that started from the country level on setting what are the 8 guiding principles for this digital transformation. Countries were asking, where do we start from? What do we need? What are these basic building blocks to start discussion and to start setting then policy that will then transform into direct actions that will have an impact on people's health? Many times we speak of many of these concepts and we speak it from a global perspective as global priorities, and we all share and we all understand what they mean. But when we come down to our countries, then that seems a bit far away from the reality that we're seeing every day and the competition there is on the use of resources. So this all started more than 7 years ago with a discussion from the Caribbean sub-region on how they could strengthen their information systems and how they decided not to call them information systems in health, but information systems for health, meaning that we need to interact with other sectors that go beyond the comfort zone of the health sector. How do we engage with education, and how do we engage with development, general development and finance, and other sectors that need to be involved so that we understand what is health and what are those priorities. So this started as the IS4H initiative in the region of the Americas that from the Caribbean became a regional priority. And then, as we discussed later on the progress made and the evaluation we had from each one of these countries and territories in the region, then it was decided that we needed to move forward. But we needed to establish these basic building blocks on what a digital transformation means, something that has been around for decades. But the COVID pandemic's clearly highlighted and made a priority within health sectors that have been lagging behind in comparison to other sectors in our everyday activities. The banking sector was mentioned, but not the overall financial system. So why can we just go to any country in the world and use our own identity card and get money from everywhere, regardless of where our account is based, but not share health information between providers within the same institution? So those are the main questions that brought this vision that it's shared by member states on how can we generate this equity in access to health services. We've been all discussing this. We've set it as a global priority. We've set it as regional and country priorities regardless of the political field of a particular government. How can we expand the coverage that we have? How can we have this transformation considering equitable access to digital health solution? Because we understand that if we don't take into account the digital divide, this will have an impact in the health divide as well. So how do we bring this into whatever policy comes forward? And some priorities, like for example, cross-border interoperability. And we saw this during the pandemic. We all wanted to have information and share information on health status, on vaccination status, and we didn't have that. And that's what everyone came together and said, how can we build this? And of course, this permanent link to innovation and resilience. So with this in mind, countries started discussing what are these building blocks. If I can have the next one, then they come to this, which is a document released by PAHO in 2021, where the number 1 principle states the need for universal connectivity. So if we don't advance on that, and that again goes beyond the health sector, if we don't make sure that everyone has access to connectivity and with the consideration of broadband and capacity to really connect, then we're going to leave a lot of people behind. we need to discuss on the generation of digital public goods. What does it mean? Where do we start? What is the role of governments? How do we interact with many others that participate? Public sector, private sector, NGO, the academics? How do we bring all that and generate this concept of co-creation? So not just importing this development from other regions or other countries, but how do we create this? And this is part, already 5 minutes and I'm in my second slide, so I'll hurry up. So going all the way to one of the main concerns, how do we create this inclusive digital health? What does it mean to consider the special needs of populations in conditions of vulnerability? Whether it's because they don't have access, whether they don't have the necessary literacy to benefit from digital solutions, or whether it's because we don't have the tools to make this accessible for everyone. Interoperability, which is very much linked to how we generate data and how we limit the fragmentation that exists within health systems. If you go to any primary healthcare clinic, you'll see how they have several different information systems, all with inputs from the same person. Sometimes based on vertical programs, they even have specific computers to do this because they've received financing from TB or from HIV programs. So if we talk about strengthening primary healthcare, well, we need to think of what is this architecture that goes around to make this happen. So human rights at the center of everything we do, and this is very much linked to the need to look at the regulations and the regulatory frameworks in many of our countries. So how do we manage to understand that it's not about just using digital tools or digitalization in terms of scanning papers to send them, print them, and sign them, but to rethink this from legislative work, basic, very local normative work, and how this then is translated into reality for patients and civil society. Artificial intelligence, I will stop there. I won't stop there. It's been prioritized. It's something that everyone wants to understand what it is, what it means for healthcare, and should we regulate it, and how should we regulate it? What's the role of regulators within health systems on artificial intelligence, when many times we don't even know we're dealing with artificial intelligence in, for example, equipment that do not make explicit this. Information security. If we accelerate the digital transformation, we are generating new vulnerabilities that we need to take care of. As we took care of fire hazard standards in archive rooms when we had lots of paper, but how do we protect the information now that we go digital? And it ends with the 8th principle, a renewed public health architecture. So again, not thinking on how we're going to use digital tools within the same processes that we have for some countries more than 100 years. But how do we rethink this? How do we reimagine what can be done in our public health in this very specific time? So if I can have the next one, and I'll promise I'll go very quickly. This is so far, so this was released in 2021. So far we have more than 50 countries and territories that have their information systems for health maturity assessments as the basic to then develop roadmaps and agendas on how to transform, how to go further, and how to continue developing. We have 3 regional policies that were adopted by all countries, by all member states at PAHO. The Plan of Action for the Strengthening of Information Systems, the roadmap for the digital transformation of the health sector in the Americas, and the policy on the application of data science in public health using artificial intelligence and other emerging technologies. We have now 10 countries that have adopted this, have contextualize it locally, and now have their own digital health agendas, which is something very big. I mean, if you consider what it requires to set up the health sector as a leading partner within government digital transformation initiatives, having 10 countries already in the region as the Americas is already a great success. We have more than 15 countries with improved digital health foundations, including the renewal of their normative and legislative frameworks. And very importantly, we have over 900 million in investment, direct investment for these initiatives through loans from the Inter-American Development Bank. And again, if I have the next one, this is something that we don't do alone. We share the space on how to support countries at the local level with many different entities. The great advantage that we have in America is that we can all go together, that we can align with global policy, with WHO, for example, that we work together with World Bank and other partners like the IDB, and that we then share this space and share how we transmit the message and put the country needs and priorities at the center so that we build stronger and sustainable policies ahead. If we can finalize, I have these materials, if I can have the last one. This material is available also at the back of the room, at the table. There are QR codes so that you can access the tools, the digital transformation toolkit, and the publications on this regard. So thank you very much for the opportunity.
Thank you, Sebastian. I think you only ran over by 30 seconds there. It was very short. I hear a real resonance between what we're hearing at that global down to regional, down to country level so far about how this is moving away from, we need to move away from thinking about just digitizing processes to that digital in health that you talked about. But that's really hard, isn't it, to forget processes? We sort of need that thing like Doctor Who has when he's met people and he touches their neck so they forget that he existed. We sort of need that to forget what the current is like so that we can do that reimagining. And that's I think, going to be the tough bit. So I'm now really interested to hear whether we get further resonance from Alan and the WHO. Let's hear from you.
So given that we're hearing from WHO and we've been sitting for 30 minutes, how about we stand up for 30 seconds and then sit back down? Is that okay?
That's fine.
Sitting is the new smoking, and just stand up, let the blood flow back in your brain, and then we sit back down. Okay, that's good. It's amazing, isn't it? I mean, just I won't say that the secret reason was I saw a few eyelids going like this, but you know, it's always this session is called the postprandial session. So for the clinicians in the room, it's when all the blood flows from your brain to your stomach, and you know, it leads to sleepiness. So thank you, Sue, for bringing us all together. It's really an honor to be here today with you, and you know, continue to share a little more about what WHO is doing to support global health. Phenomenal tour de force from our fellow panelists, and it sets the tone for this WHS. It's a beacon for, as Marlies put it, digital in health. In 2023, as you said, you know, we don't talk about e-banking, and hopefully in a few years, we won't be talking about digital health. If we get this right, Indonesia has shown us what can be done with clear government-led vision, with solid foundations in governance and policy and architecture. And Sebastian, I mean, bravo to PAHO for what they've accomplished across that region. But Sebastian grounded us in the whys of digital transformation. WHYS is W-H-Y. A reminder of the digital divide and the need for really a focus on equity. The Broadband Commission this year at the UN General Assembly reported that still 2.6 billion people on the planet remain disconnected from the internet and from broadband access. So there are real problems that we need to shake ourselves to address as we look at digital transformation. But that said, the pandemic has driven the state of play for digital health. From one of, we used to talk about the potential of digital health, the possible future, to the reality of the present. We see digital health is accelerating to scale across the globe, whether you're in sub-Saharan Africa or in South Asia or in Latin America. We're beginning to rethink and move from the state of digital experimentation, which is where we've been for 15 years, to using these words of digital transformation. And what that means is to rethink how we deliver services to rural, remote populations, to urban populations. How do we engage people in their own healthcare journeys? How do we make person-centered care a reality? And it's not by uploading paper-based approaches into a digital platform. As Marlies mentioned in her document, that would be what we call digitalization. You take a paper process, you upload it in a tablet, and now look, we have digital health. But what we have to do is reimagine. We have to reimagine systems in a new digital paradigm. We have to understand that the way we deliver public health today is a reflection of the paper-based reality in which those systems were often designed. I'll say that again, right? So the way we deliver public health or global health today is a reflection of the paper-based reality that forced us to design them that way. So that's where the transformation comes in. That's where this reimagining comes in. If I can have the next slide. So WHO serves as the secretariat for the Global Strategy on Digital Health, which was endorsed by 194 member states in 2020 as a way of aligning actions and goals while defining this clear roadmap towards digital transformation. And it's beautifully reflected in the 8-point agenda that Sebastian just shared. Across the 3 levels of WHO, we have the HQ in Geneva, we have regional offices across 6 regions, and then we have country offices. We work to support the countries in strengthening their health systems. What we do is we provide normative guidance, technical support, all with one goal, for government to be in the driver's seat of their national digital transformation journeys. And despite the pandemic, which set us back quite a ways, we've made significant headway on this strategy. Just this year, we've launched the Global Digital Health Certification Network. Those of you who were in the session this morning heard about that, and I'll share a little bit about this. We've also expanded guidance and standards to guide national systems, and we've launched new global initiatives in digital health and in AI for health. Next slide. For about 20 years, we've worked to bring rigorous evidence and science to inform how we use information systems to strengthen healthcare around the world. It's not about shiny objects. Governments do not have the resources to waste on ideas that are driven by folks who have a commercial agenda. But they look to WHO for the guidance that is evidence-driven and science-based, that these investments will yield outcomes that benefit the people. And so those strategies and technical expertise help us to invest in digital solutions that are aligned with the national health system strategies and the priorities of those countries. Some countries' priorities are different than others. We've heard several panelists mention this, and that's critical to how we undertake digital transformation. Next slide. The recently launched, and here just on the left-hand side, the Global Initiative on Digital Health, which is called GUIDE for short, enables us to address over 70% of the proposed actions for the global strategy on digital health. This is a WHO-managed network, which all of you in the room are welcome to apply to join, looking to amplify and converge efforts across WHO, across UN agencies, development partners, including the World Bank, including agencies like Google, across the regions, focusing on the foundations, the roads and highways that digital innovations need to drive on. For those of you who've been doing digital health for a long time, you know that we've been focusing a lot on the projects, the experiments, and very little investment has gone into those foundations. And that's what we need to correct now. What we're doing is we're seeking to optimize the use of limited resources. Global health financing is shrinking, and we need to use those resources to drive clear national strategies, to train people to live in a digital environment, to improve governance that we've heard now multiple times, and build digital public infrastructure. If there's one thing you take away today, digital public infrastructure. And locally built and maintained standards-based solutions. So we don't have time to reinvent wheels. We're falling behind on SDGs, and we have to ensure that nobody is starting from scratch. So your point about the digital public goods is absolutely that. What can we provide countries so everyone gets to start at 70 or 80% of the way there? In parallel, here on the right, WHO is also focused on strengthening international digital public infrastructure as a key building block to delivering health for all. So in June of this year, WHO took up from the European Commission, building on the experiences of over 80 countries that during COVID joined together in a global trust network, the WHO Global Digital Health Certification Network. So this network is now operational as of the beginning of September. We have almost 40 countries that have joined in the last 5 weeks, and many more are applying to join. And this allows people to travel freely across borders, as the custodians of their own trusted health information, such as immunization records, patient health summaries, and e-prescriptions. Next slide. Artificial intelligence is a central part of how WHO is exploring supporting member states in achieving the health SDGs. And there's 3 reports that we just launched around the core values, the ethics and governance of AI for health. How do you generate evidence for AI-based technologies that are being used in the health sector? And what are the considerations when you're developing regulatory frameworks for AI for health? So we've hosted since 2018 a group of over 100 experts in AI called the AI Focus Group. Many members are here at this meeting, so look for them and talk to them if you want to know more about this. But they have helped drive consensus on what should be these foundations that we then convene and put together in this global guidance. Next slide. So just to say, I would like to reiterate that digital is an enabler for us to act faster. If we all went home today and did nothing about digital, in 50 to 60 years' time, we would have digital health transformations. It would happen in an inequitable way. Those who could afford it would get better services, and those who couldn't would get worse services. So I think our collective responsibility here is to ensure equity and to ensure that everyone has access to these innovations before 60 years take place. Inaction on our part will lead to lost lives. This is not just about shiny dashboards or better data. These systems have demonstrated there's evidence, and WHO has published evidence-based guidelines on the use of digital health. They are able to reduce mortality, reduce inequity, and promote access. But to do that and to be sustained, they have to be built on solid foundation. We have to stop reinventing wheels, and we have to leverage our collective strength and act together. Our friend here, Ilona Kickbush, reminds us every year that health is a political choice. So is the decision to harness digital. Thank you.
Thank you so much, Alan, and thank you all the panelists, and welcome back. Mr. Satyarthi, we can see you now, which is great. So I heard a few things consistently through all of those at that international, regional, and local level, and from a sort of a global company in Google, which is the need to accelerate and to help countries leapfrog so we're not reinventing the wheel, the need to scale, forget pilotitis that we've all lived and breathed through, the need to reimagine as opposed to just digitizing our current processes. Mr. Satyarthi, from an Indonesia perspective, having heard your fellow panelists talking, does that resonate with you at a country level of how you're approaching things? And tell us about, sort of, if so, something that's been really successful and how you've navigated that at an Indonesia level in that case.
Yeah, thank you. I already present about our strategies and initiatives that have been implemented in recent years, highlighting both their successes and also surprising outcomes. In the beginning, in the individual level, digital solutions empower us to bring healthcare closer to the people, including through telemedicine. As a nation comprising more than 17,000 islands and home to 270 million people, telemedicine is of paramount importance in expanding healthcare services in Indonesia, especially after the pandemic. During the COVID-19 pandemic, for instance, we successfully offered treatments and deliver medication to people's home through telemedicine. This surprising outcome has been the rapid adoption of telemedicine and e-health platforms during the past couple of years. The COVID-19 pandemic accelerated the adoption of digital health solutions, making healthcare services more accessible and convenient for many Indonesians, even in remote areas. And the second, at the country level, it is crucial and also challenging to be able to collect reliable and standardized data while at the same time protecting privacy for effective data-driven public policy making. As I mentioned, Indonesia has created a standardized national health data platform called Satu Sehat, and this acting as a central hub for connecting and sharing data among different electronic medical record systems. And then the last thing about the committed to implement digital health regulation and standardization. In its implementation, policies are made to foster efficiency and effectiveness. Digital transformation policies in the health sectors included not only regulation but also standardization and data integration. Our parliament has just passed a new bill for the health system. This is an omnibus law. We merged 9 laws into one. This is like a booster to accelerate health service improvement, especially in the health digitization. We put in opt-out for this regulation to give a power for the government to access personal medical records directly from all the health facilities. And then the last about the data standardization and integrations. Yeah, we're lucky because the standard and technology already exist and are becoming mature. So we just use the standard and some technology from the many technology partners. And also we use like a cloud exists in Indonesia. And the last thing, however, it's important to note that challenges still exist. For example, like healthcare infrastructures. Indonesia is an archipelago country, so we still have some issuing about the internet access. Because of that, last month, our ministers directly come to the Elon Musk to support the internet access using the satellite. We hope with this initiative can accelerate the digital health industry in Indonesia. Thank you.
Thank you so much. Sebastian, I think I'll come to you then from a regional perspective. I think on your slide you talked about how 10 countries have now signed up to your 8 missions. How hard has it been to sort of get people to think in the way that you're talking about, this sort of reimagining piece? How much of a journey is it to get ministries of health and government leaders to kind of go on that journey of understanding it's not just about digitization, it's about digital in?
Thanks for the question. So, I mean, it begins with there's no standard. As in, every country is different and they have different needs and competing priorities and availability of resources and how they assign this. So we come from the need to establish the basic analysis of all countries for them to use. So that's why we started by conducting this IS4H maturity assessment on where is it that they are based on 4 domains, and for them to have that information to then construct a roadmap. And that's how these 10 countries managed to move forward, because they realized where is it that they were standing on, the potential and the direction that they want to take. Plus the alignment of all of these other international and regional entities that are able to finance this change. Because it's easy to say from an outsider, oh, this is what you should do, and look at these recommendations, and these are the priorities, and this is the global priority. But then how do you establish that change? Where do you start with? And then how do you get the fresh resources to generate this transformation? It's not easy to say. So for example, we got resources, WHO as a whole, and PAHO particularly, we have resources from many of the partners that I mentioned to conduct technical cooperation activities. But technical cooperation activities will reach a point where a country can then set a diagnosis and maybe a roadmap, but not necessarily take the actions on hiring all the necessary staff to push this forward, or conduct all the training necessary to transform how health services are even thought of in terms of the architecture. So this is why it's a whole community approach. It's the government with all of the entities working together. So there are countries that have given very important leaps on this, from the Caribbean sub-region, where you have great examples on solid information systems with revisited and renewed legislative and regulatory frameworks and governance mechanisms to improve information systems and conduct this regional perspective on the digital transformation agenda. You have huge countries, like I would say even continental countries like Brazil, that have prioritized this and have made changes in even the structure of the Ministry of Health to reflect as a priority within health a position for digital health and information systems. And this is how you start changing this, and how then you manage to link with other entities across government to position health and the health sector as such as part of the leading mechanisms within the governmental transformation. You have other countries, for example, Honduras in Central America, that from having still very much a need on basic infrastructure, primary healthcare facilities and hospitals, and now they're seeing this agenda as a way to strengthen their primary healthcare system, because they've realized that they have an extremely fragmented information system that needs to be rethought completely. And so you don't have one country, one priority. You have a group of countries from Uruguay that has been a lead on this over decades, all the way to those that are innovating because they don't have those same resources. So I would keep an eye on all of them, and that's what we do, and we work with them, and each one sharing their experiences and having this cross-learning from all of the opportunities generated.
And I like the way you've said that it's clearly not just a push down from PAHO, it's a two-way learning experience where you're learning from the individual countries as well as being able to then spread that more broadly. That's super to hear. Ivor, having listened to your fellow panelists and kind of heard their approaches to this digital transformation journey, what role do you see a company like Google having to play, or not having to play, playing in this arena, particularly with that focus on equity globally?
Yeah, thank you, Sue. I think it has been wonderful to hear this conversation, and one of the things that I think about is, one is humility in the role that we play within this ecosystem, because I think that is important as part of this process. But also, some of the same things apply. The foundation of what you're saying here is really about partnerships. And it's really about respect for the people who are sort of boots on the ground, who have the experiences, and creating tools and resources that actually meet those needs. And so oftentimes as we're building a technology, and for our team is working with technologists and engineers who are thinking through, how do we build something? Our task as the health equity team is to really say, how can we expose you to those people who have the experience to understand what truly the need is? We're not necessarily the last mile, but we are partners in those who we can bring those resources to make sure that we're doing that. And so for us, that is part of the work. How are we thinking about that infrastructure, and how are we thinking about the tools that we have in our toolbox to do that? For example, the work that we do at Search. For example, the work that we do in YouTube. But if you also think about the work that we're doing with Open Health Stack, how are we creating those tools that are actually working with the community health workers who are using evidence-based in their communities, in their areas where they know the people that they are working with? How are we putting tools in their hands to be able to do that in a way that is transformative? The other thing that we think about is how are we thinking regionally and globally as part of that work, and how are we bringing that information? How do we partner with people across the country? How do we partner with PAHO, and how do we partner with the WHO as part of that effort? And so I think for us, in the role that we play in the technology that we build, one, being a global company, being part of a global community, is making sure that we're making those connections as part of this work.
Thank you. Marlies, you talked about the report that you've just published, and clearly there's lots to be done, and we want to accelerate the digital in health piece. But that's not just by throwing money at it. Indeed, one of your things was about the need to get better return on investment, and it's not, that we need to be reducing costs where possible. So how do we accelerate this work, and what have you heard from the people that were sort of contributing to the report on that?
Great question, Susan. And I would say that your question really makes me think about those times that we sit with ministries of health and ministries of finance in conversations about how can World Bank financing best be used to bring the best health to the most people. And in those conversations, there are two questions that governments always ask, regardless of whether it's about digital or investment in TB or another program. The first one is, what is the value of this compared to everything else? And the second question is, can you show us examples of other countries that have done this really well? And I'm mentioning this because I think this is really essential to how we approach this next wave of evolution of mainstreaming digital within how we think about health. And that is that we almost have an inverse knowledge pyramid. I think for a long time in global health, there's been this notion that we have a few experts that is going to disseminate the knowledge and make sure that countries fall in place. I learn every day, every time I hear Mr. Sitchaji speak about the Digital Transformation Office and the things being done. In fact, we're going to Indonesia in a couple of weeks to learn more about how Indonesia has done things. The World Bank has a global joint learning network that brings countries together to learn about things like digital health. When we spoke with countries, we spoke with stakeholders who've been on the receiving end of digital health investments. Their main points to us have been, as part of the research for the report, has been that we want to have a voice and be the determinant voice in which investments get prioritized and which problems digital technologies can solve. And in fact, it was quite an intense debate in the World Bank as to whether we should publish a flagship report or a set of implementation know-how briefs that just recognizes all these experiences that countries have already had. And in the end, we ended up producing both. So we have a report and we also have a set of implementation briefs to find a good compromise as we always try and do. But that's where the rubber really hits the road, is can we articulate, those of us who are in the room today, we came to a session about the power of digital technology for global health. I bet if we did a survey at the start of this, none of us would have said technology doesn't have a role to play in health. We are the ones collectively who already believe in this. But ministries of health in many countries have to make incredibly difficult choices. In some low-income and fragile state countries, they have to, compared to their spending on health before COVID, double their proportionate spending on health just to get to pre-COVID levels of spending. So if they spend 10% of total government revenue on health, they now have to spend 20% because government revenue has decreased just to get back to the same levels of health. If I'm a Minister of Health and I have to make a decision between buying a bed net and buying a computer or creating connectivity, those are the real choices that governments have to face every day. And I think that is where the decisions that we make in digital, we can't afford pilotitis anymore. We can't afford assessmentitis. We can't afford indicaritis. We can't afford any of these ills that have plagued health information and digital technology for such a long time. We have to collectively put our best will and our best effort in place to make sure that countries are delivering simple health services that people need in seamless ways, and we have to do it quickly because the world is digitizing. We can just, as Elaine said, we can help collectively to influence how it is done and make sure that it is done in a way that we don't create an unbridgeable gap between those who have access and those who don't. And so I think that's what we see in terms of the real difficult choices that countries have to make and how we collectively, not just the bank, but all of us here, all of us in the room and beyond, what it is that we can do from the various places where we're at to really make sure that we bring that value, that we think of people first, and that we use this technology to solve problems.
I think that's spot on, and that bit about centering people at the heart of it is really important. I mean, it matters little at the moment whether you're in a high resource or low resource setting in terms of those difficult decisions. You know, you've got a waiting list that is sky high because of COVID, and you're being asked to invest on stuff where the return might be 2 or 3 years down the line. How do you make those choices? It's a tough one. Those know-how guides that you ended up compromising on, are they being well received and used that you can see lots of
Yes,
action from those?
They are. If anything, there's a big demand for more, right? Every day we're like, well, we don't just need one on this, we need one on regulatory sandboxes, we need ones on health information and so on. So, and again, this is collectively through the Joint Learning Network and partnerships with others here in the room and on the stage. We hope to continue to build those know-how briefs. That's really a reflection, just a mirror of the excellent work and the pioneering work that so many countries are doing. And I have this, we always in AI talk about humans in the loop, right? I feel like collectively we need to not just be in the loop, we need to be on the loop, right? We need to be the ones guiding, and collectively all of us from the various places that we're at. And I think we have a real opportunity to do that. I'm boisterously optimistic about digital health, partly because of where I am, but not just because I have to be, because I really believe that it will be the tip of the spear to change how we think about health and what good health means.
So Alan, if I could come to you, just hearing there about those sort of, that toolkit that feels really important. I know at the WHO, that's at the heart, not least some of the work you've been leading around smart guidelines and making sure we're trying to standardize how care is delivered and allowing that to be digitally enabled. It would be interesting to hear, given you talked about the strategy being from 2020 to 2025, we're sort of just over halfway through that, I guess. How do you feel you're progressing on the journey that you need to be on in enabling those tools to be reached by people?
I think it's this room. I mean, we have a packed room. This conference hasn't even started yet, and here we are talking about digital health as a key enabler. Indonesia, I mean, these are examples in the flesh, the revolutionary work that's happening across Latin America has just demonstrated that progress is being made. And I think it's central to understand that these investments, billions of dollars with a B, have been made in the last 15 years in e-health, IT for health, digital health, M-health, and lamentably, most of these investments only have lasted the duration of the grant or program fund that have supported those projects. So at the recent UN G20 meetings, Chris Elias, the president of global health at the Bill and Melinda Gates Foundation, presented an analysis that they had commissioned to really look at the landscape of investment in digital health. And what he had shared was, in Africa alone, they mapped 880 apps and platforms that had been invested in over the last decade. Only 390 of those had actually been nationally scaled. But most telling, 50% of these projects were donor-driven, not funded by the national priority or a national strategy, as Sebastian nicely outlined, but funded by something that was a interest of a specific funder who wanted to use digital as a tool for that strategy. So a lot of this emphasis that we're placing on the foundations, on the governance, on the policy, on the architecture, stems from detailed and extensive learnings of introspection. All of us, many of us in the room, including myself included, were part of the impetus of the pilotitis that we lament in this room, right? So the fact that we've had all these pilot projects and experiments, but those experiments gave us confidence to be where we are today. And it would be a shame if we didn't look back and learn from why these didn't scale. And then the answer is what you heard from many of us on the panel today is there has to be an investment in the foundations, in the building blocks, in the core infrastructure that's needed to sustain the digital projects that are so important to accelerating health. And so when we look back on our global strategy, that's really where, coming out of the pandemic, we look at what we've learned, and what we've learned is that to move from experimentation to transformation, we have to build governance, right? So countries need to have the people who have the mandate to shepherd digital transformation, to be monitoring whether resources are being spent wisely, both in building roads and highways, but also the cars that run on the roads and highways. We have to invest in both things. They need to have a mandate to ensure that things like interoperability are baked into how digital health is done in a country level. Many of you might remember in 2011, the government of Uganda issued a moratorium. The Ministry of Health said no more e-health projects until you register what you're doing with the ministry, because there was so much discordance. Projects doing the same thing in different districts, different projects doing different things, but using the same technology and charging the government twice for the same project, right? So they just said cease and desist until we get control of this situation. And so we no longer have those kinds of pilotitis adverse reactions anymore, because countries are taking the driver's seat. They're setting the rules of the sandbox in which digital proliferation happens. We're seeing in India, in Indonesia, governments defining the national standards. If you're going to be building digital solutions, you're going to use this standard, and that's going to allow you to connect into everything else, right? So that's really where we're seeing this shift happen. And I'm actually, we may be a little bit behind. I might ask for an extension on my homework, as it were, as a former professor, to deliver on the promise of 2025, but not too many more years before the vision that's enshrined in that document becomes a reality.
Thank you. That's great to hear, and I'm sure you're gonna get there, Alan. I have no doubt. And ask for that extension if you need it. This whole digital transformation, though, is going to need different skills and different ways of working for all healthcare professionals and systems, right? Not just doctors, but community health workers. And whilst I don't think any of us think that digital will replace people working in the health arena, we know that everybody will be working in the future with digital. Doctors with AI versus doctors without AI, doctors with digital skills. How do we need to think about that skilling up? What's our responsibility to help with that? Marilise, maybe we'll start with you, and then Alan to back up.
I mean, I think that, we need to start by thinking both about the current health workforce, but also future health workforce, right? I think there's a lot of work that needs to be done in building digital competencies into both into pre-service training, so that as we build digital skills in the future, we have a health workforce that knows and trusts these technologies, and I think particularly have the critical thinking skills that is needed to neither always trust what an AI-driven solution gives, but also to not never trust what it gives. Because I think we find on that automation bias spectrum, both extremes, right? We find people who always trust, and we find people who never trust. And I think it's that critical thinking skills that, particularly for the current health workforce, we need to carefully think about how we do that. But even if doctors are interested, if one looks at the initial data that's coming out about do patients trust and do patients want their radiology is by far the early adopter of AI, right? Do patients want and do they trust solutions that come from radiology? It differs significantly from country to country. So again, there's a role for countries to be in the lead, to think about medical education, not just for health workers, but also for people who ultimately, patients and non-patients, who ultimately need to decide, am I going to trust a community health worker with an ultrasound connected to the phone that says this is a high-risk pregnancy or not, right? Those are the places where I think we need to think in a very all-encompassing way about medical education.
Alan, I think you want to
I think it absolutely, when Marilise, in-service training and pre-service training, absolutely critical. And to drive that, we need competencies, right? We don't have digital health competencies for either right now.
Yeah.
We have degrees for health informatics. We have different programs offering certificates on digital health. But WHO this year has convened a global expert panel to begin developing competencies for this new digital health era. And so it's competencies that start with policymakers. What do policymakers need to know in order to make responsible decisions about digital health? What do planners and implementers need to know in the area of digital health? And it's more than just need to know, it's need to know, be able to do, and what sort of normative behaviors they need to emulate. And then at the, so we have the policymakers, the planners, and the providers, right? What does a digitally enabled provider look like? What are the skills and technologies they need to be able to do? But last but not least, it's the people, right? What does digital hygiene look like? We're all taught to wash our hands. We're all taught to, you know, behaviors before and after we eat food. But what is basic digital hygiene as a citizen living in a digital world? What do we need to know about safeguarding our own data? What do we need to know about sharing data with others, right? So I think there's competencies across that stack that hopefully in the coming months we'll have available as a starting point for then all of you in the room who are responsible for building training programs to go out there and help sensitize those standards.
And Iva.
Yeah, one of the things that I think is really important as we think about this is not just the providers, not just the people within the health system. It's the retraining of the staff and the community who are going to be bringing people in. It's the retraining of the social worker. It's retraining of the community health worker who are really on the front lines, who build that trust, that bring people into our doors. And I think it is, as we think about sort of pilotitis, it is all of that innovation that comes from the ground up, and you have entrepreneurs and innovators who are thinking about that, and they came from a ground up to a system that wasn't quite prepared for them, which led to our pilotitis. And so our opportunity to say, how do we create that infrastructure is really important. And we also need to make sure that we're thinking about those technologists and innovators who are thinking about what is happening in their community, what is happening in their home, what is happening in their region, the solutions and the problems that they are trying to solve. Now we're creating an infrastructure that is ready to receive them. And I think it is really important because that is when the equity part is going to occur, because it is not often what we know in our healthcare systems. I, as a provider taking care of a patient, don't see the things that brought them to the door. And how are we building those solutions and making sure that we're ready for them when they come to us? Radiology is something that we see within our health systems, which makes it easier for us to adopt because it is something that we're building and driving from. It is those things that come from the community that solve problems, that deal with primary care. The community health worker sees that simple, to your point, it's AI in the background, but it is a simple problem that is being solved that actually has the biggest downstream impact. So I think it's really important as we're thinking through this process of the top down from government and from policy, that we make sure that we don't forget the entrepreneurial community that created that pilotitis that got us here, because that's going to be an important part of the work in creating tools that will allow them to have standards and allow them to meet the standards so that more and more can contribute and participate as part of that process.
And I think that point then furthers into the whole point around equity and accessibility that you were just talking about. Ensure, we all say that, you know, everybody has access, but actually, Alan, I think your statistic was 2.4 billion people still don't have regular access even to the internet, let alone other more fancy things, right? So ensuring that we feed into that accessibility, I think, is going to be really important. So I think we're probably within about 5 minutes of the end. So I'm going to start wrapping us up. And I'm going to sort of ask you one final question, which will be the same question to all of you, if that's okay. In the room today, which is packed, and again, we're really grateful for you all coming out today to listen to us. We have leaders from around the world, from government, civil society, NGOs, private sector, from across all walks of life. To make digital health accessible for everyone, everywhere, what do we need to do? So in one sentence, I know it's difficult, as you've shown in all of your little speeches, to keep to one sentence, but I'm going to push you on this. What is the one thing every audience member should be taking back to their respective organizations and saying, we need to, or we need? Alan, yours is obviously an extension on year 20 to 25. But no, what one sentence should people be going back with to their organisations? Let's start with Mr. Setiaji and then we'll come to Marlies.
Yeah, thank you. Yeah, I will give the philosophy of success. Coming together is the beginning, keeping together is progress, and working together is success. So we need to work together and partnership to make and secure digital health infrastructures and healthcare services. Thank you.
Thank you.
We need to use digital and data to unlock people gains, health gains, and efficiency gains.
We need to ask ourselves the question, it is our responsibility to ask ourselves the question, who's not in the room, and how do we get them into the room so that it really is built for everyone, everywhere.
Sebastian.
So to truly harness the power of digital technologies, we need to have them centered on countries and people's needs and have an equity lens in everything that we do, as we are not the same. We don't follow the same plan. So having this at the center all the time.
So we need to use intentionality and inclusiveness in designing and building solutions that address problems that people feel in their daily lives.
Mm-hmm. Well, thank you all for those single sentences. You all stuck to the task and did it, which I think might mean we've even wrapped up. We're wrapping up 2 minutes early, which feels astonishing. I'd like to thank our panel today. What an amazing conversation we've had, kind of going through the breadths of how we need to move beyond digitizing processes, how we need to scale, how we need to make sure everyone is in the room to ensure equity and access for all. I'd like you to now thank the panel, Marlies, Ivor, Sebastian, Alan, and Mr. Setiaji. And I hope you have a really fabulous World Health Summit. Thank you to Alona for bringing us all together here, and enjoy the opening ceremony. Thank you, team.